What I'm doing is traveling around the country to highlight a new initiative that we are launching in conjunction with employers and patient advocates, with health insurers and health providers to really focus on improving care, saving lives, and lowering costs. The Partnership for Patients now has 3,000 of our partners who have signed up, including 1,500 hospitals. We're really pleased, as I say, to be here with the Henry Ford system because they are one of the leaders, and that's really why I'm here, because while we just launched this effort in April, this hospital and the surrounding partners have been engaged in the safety initiative for the last 3.5 years in a very focused way, and probably years before that, trying to figure out ways to improve care. And I've just seen some really impressive examples in terms of the kinds of training that young residents go through. I think you said you train a third of the doctors in Michigan. So the ones who go through this training are practicing on simulated models, not on patients. Partnership for Patients is focused on initially two goals, two very achievable goals: to reduce by 40% the hospital infections that occur across the country, and to reduce by 20% readmissions that are not necessary in the first place by better follow-up care. Those two efforts in and of themselves will save about 60,000 lives, 60,000 lives in the next 3 years. That's one of the goals, and billions of dollars. We think this is a great example of the kind of effort that actually does reduce costs, improve care at the same time, and that's really part of the goal of the Affordable Care Act is to deliver better care to patients and lower costs. And Henry Ford Hospital is a great example of that. So I'm excited to be here. We are not only trying to engage this on a national level, but really have a spotlight on some of the best practices around the country. Part of this effort will be sharing these best practices with not only other healthcare providers throughout the state of Michigan, but throughout the country, to say we're not just making up these goals. They are achievable. They are very real. And the goal, frankly, is to get to zero, no harm situation, because 20% are too many. 10% are really too many. And this is really about re-engineering a system of care. Healthcare providers work hard every day to deliver the best possible care and are doing the best possible job, but too often the systems that they work in haven't been re-engineered to be fail-safe and to have the backup systems. And if you think about something like the airline industry, where pilots are trained and go through extensive training, but then the airplanes themselves and the system around flying the planes have all kinds of safety backups. So if anything happens, there are 3 or 4 or 5 different backup systems. Too often healthcare does not have that system design, and this is really about putting those tools in place to not only figure out what the best practices are, but to do them then each and every time.